Hello everyone, Jane Burns, Medical Director here, and I'm standing in for Heather Knox this week. I wanted to take a few minutes just to acknowledge the exceptional level of pressures that you've all been dealing with, particularly over the last few weeks. The past 18 months have been the hardest of times, I think, for all of us. I think most of us would acknowledge that we've seen some of the greatest challenges of our working lives, and that happening to us at the same time as we're facing similar challenges within our home lives as well. So it's been really, really tough. And I guess none of us thought that we would get to this point 18 months into a pandemic without seeing some easing of those pressures. But across the country, it's undoubtedly been the case that our systems seem to have changed, and we're beginning to realise just how much impact the pandemic has had on the delivery of our systems of care. And it's not just about the COVID cases, because they are diminishing slowly but steadily, but it's also about delayed presentations of patients with non-COVID illnesses. And fundamentally, it's about how the pandemic has changed things, how it's changed the way that services are being delivered, about public perceptions of how those services are being delivered, and how they choose then to access those services, and that change in behaviours has been quite challenging for us. All of our services are open, and they're actually working harder than they've ever worked before, but it's very different than it was from before the pandemic. Our GPs in particular are working harder than ever, but they're struggling to cover not just their home visits and their surgery appointments, but to support out of hours and to support community COVID assessment pathways as well. But because less of that is face-to-face than it was previously, it's not always recognised by the public that those services are in fact open, and it's being interpreted differently as to the impact that that's having on how people should access our services. And wider than that, I think because there's social distancing still in places like pharmacies, in your dentist, in optometrists, they all look different as well, and there's a perception from the public that they are harder to access, and again, they're making choices about accessing healthcare. So the last 3 weeks have seen literally record numbers of patients attending across our systems of care, but in particular at our emergency departments. Lots and lots of minor injuries and illnesses, and in particular young children with high temperatures, because there's been high levels of paraflu in the community. But it's important to rule out COVID also in that population as well. COVID cases still coming through the system, no doubt about that, although in reducing numbers, but very significant acute illness in patients with non-COVID illnesses or with COVID alongside other presentations as well. Increased demands on our inpatient beds and critical care services, and that's in a population who are a bit deconditioned because people have been isolating at home and they've not been exercising as much, so they don't have the same capacity to have a reserve to manage acute illness as well. Length of stays therefore is longer in hospital for those who need to be admitted, and discharges are harder because more people are requesting care at home than admission to a care home because of the challenges that sector has faced in the past 18 months as well. So all of that, a bit of a perfect storm, isn't it? And that's been on top of probably some of the highest staffing challenges that we've ever faced as well. Lots of people taking very hard-earned annual leave, and we were very clear within the exec team that we didn't want to do anything to compromise the ability for our tired staff to take their annual leave. But still increased sickness of people our staff having COVID. Also self-isolating, having been in contact with people with COVID, although we now have some guidance to help us with that. And that's all added to the usual impacts of sickness absence. I've always asked you to make sure that when there's high levels of activity, the most important thing that you can do is make sure that you keep our patients safe and that you keep each other safe as well. But I know how hard that has been recently, and much harder than I've ever seen it. Everyone from the frontline clinical teams to the admin and support services the management teams, whether that's your department management teams, the service leaders, the hospital site managers, everybody, and the exec team as well, have been aware of and felt that increased stress within the system. I'm so proud of how you've responded to that level of demand, and your ability to rise to these kind of challenges never ceases to amaze me. Slightly self-indulgent here. Coincidentally, last month marked the 30th anniversary for me of joining NHS Lanarkshire as my work family, and I choose that description quite carefully because that's how I've always felt about working within NHS Lanarkshire. We are a family. We might fall out occasionally. Sometimes there's a wee bit of sibling rivalry goes on, but actually when we're under a lot of pressure we pull together, and we usually manage to pull it out the bag. But I don't want to diminish what you've all been through. Although we've managed to cope, I know that that's been quite traumatic for many of you, and that there'll be many of you who are dealing with some really harrowing memories that you've got to cope with and come to terms with for the months to come. And I hope that we've put enough support and staff wellbeing measures in place to support you with that. I do hope that some of the pressures will start to ease quite soon. We've been working hard on that. We're recruiting additional staff, particularly in physiotherapy, and that's to help across both primary care and secondary care services. Last week we saw 130 Band 4 nurses recruited to NHS Lanarkshire, and I think 54 of them have already started, so that's good progress and should help to make things feel a bit easier. This week saw the changeover of all the doctors in training. Some of those young doctors are starting in their first ever job since qualifying from medical school, and I do remember what that felt like too, and I hope that you can recognise that they've all been through their own personal COVID experiences elsewhere and welcome them into the NHS Lanarkshire work family too. We continue to try and open up services to create alternatives for people to access their healthcare in different ways and not come to the front door services. That is challenging, and it sometimes involves 3- and 4-way manoeuvres to try and make sure that we don't inadvertently put other pressures onto our systems of care. But those are going to be the challenges that we will be progressing over the next few weeks, and I hope that will start to make some difference to your working environment and to your work-life balance as well. And thank you again for everything that you do.